experiencing some upper trap tightness, so we're just going to focus on trying to loosen up the area by using some cups. The cups primarily are used to speed up the healing process and kind of increase more blood flow and circulation. So I'm just grabbing some cups here. We're going to use some lotion and kind of spread it around the area to kind of make sure the cups do not pull on his skin and they're a little bit more movable. So generally, I just kind of spread it around with the cup and I'll start to pump. And so what it does is it kind of pulls the muscle up, brings more blood circulation, increases the extensibility of his muscles, helps relieve some tension. Does that feel right? Mm-hmm. So generally I'll leave it on for a couple minutes or two. As you can see, he's already turning red, which means it's a good sign he's getting some blood circulation. The darker the circles are, the more stagnant the blood is, meaning it's not circulating as well. So for right now, you can see that he doesn't have much circulation in there. Specifically, certain areas can, particularly his upper traps, can cause headaches. It can cause decrease in range of motion with his neck, cervical spine. So I'm just applying a little bit more, kind of cover more area. And I generally will leave it on for a couple of minutes, like I said, and eventually I'm going to have him kind of turn his head, move his head, or do some other movements to kind of intensify the cups. Is that all right? Mm-hmm. I'll probably have you turn your head to the right. So let's start straight, and then we'll bring this arm down. Actually, bring this arm down, bring this arm over your head, and then turn your head to the right, and then pull down. So as you can see, it's really red. It's got very little blood circulation there. I'm just intensifying it by having him stretch the area a little bit. Reach for the floor a little bit with this arm. Yeah. And just keep pulling down. Yep. And then you can relax, rest. Let's try the other side. So turn your head here, this one down. So depending on the patient and what they're experiencing, sometimes I'll do more, sometimes I'll do less. It just really depends on what we're trying to accomplish. For right now, I'm just having them kind of loosen up the two areas up top, and you can relax, and then do that one more time. Turn, reach for the floor. Good. Sometimes I'll pair this with scraping, kind of very similar to the cupping, except it's more superficial, not so much deep. But for John, he's got some neck tightness, some irritation, sometimes getting headaches, so this is a good way to kind of start it off. All right, you can relax. Let's try hands on the table, and then you can do some protraction, just kind of pushing forward, kind of round it out a little bit. Yep. This one's getting dark quick. And then release, and do it again. And release. So after a couple minutes, I like to loosen it up, and then I'll actually move the cups with it. So we'll start with the left.
I know, super tight.
It looks pretty painful, but sometimes it's okay. It's not as bad as it looks. So now I'm just going to try and move a little bit more, kind of get more circulation going. It doesn't help because your skin too super light.
Feels good though.
Let's tilt your head again, like with to the left until it brings this one down. So I'm basically just moving the cup around, trying to get a little bit more circulation. As you can see, he's kind of turning a little bit more red because of that stagnation. Some more blood vessels are kind of getting irritated there, but again, that's the whole purpose, is to inflammate the area to bring more blood circulation. Gonna do the same to the left now. So it's just kind of a light sample size of the kind of cupping that we do here. What I'll do too is I'll kind of spread out the little blood pools that he has and just kind of massage it out. Again, it really depends on the patient and what they need, what's, you know, what their ailment is, and you know, things can be done a little bit more aggressively, it can be done a little bit more less. But for here, for John, just him kind of getting some of this tension now is just very light. All right.
Mm-hmm. That was good.
Yeah, it's like super tight.
Yeah. That's why I go see Joel sometimes.
Should be good for today. Try a little more next time. All right, that's it. Pretty much it.
All righty, thank you.